Welcome. The following presentation on general wellness in children who have been diagnosed with autism spectrum disorder, or ASD, has been created as a part of the New York State Centers of Excellence grant project. The Centers of Excellence sites include Developmental Disabilities Institute, the Center for Discovery, and Upstate Cerebral Palsy. This brief training was developed to increase one's broad knowledge base related to general wellness principles as they apply to children with ASD. The information presented will be extremely useful for families, caregivers, support staff, and all other interested parties serving individuals who have been diagnosed with autism spectrum disorder. Please be advised that this presentation is not intended to provide individualized program planning. Rather, it is meant to give the audience a wide range of basic ideas related to promoting general wellness for our children. At the conclusion of this presentation, you will be able to discuss general wellness principles related to exercise, sleep, nutrition, and emotional regulation. You will be able to list the common co-occurring conditions in these areas, which may impact individuals who have been diagnosed with ASD. You will also be able to develop your own ideas and create a program which may help a person who has been diagnosed with ASD to improve their overall general wellness. Let's take a moment to go over some true-false questions that may assist you in gauging your present level of knowledge on this topic. Do you think that children with ASD may present with irregular sleep cycles? Do you think that as a group, children with ASD present with higher rates of overweight, obesity than their peers? Do you feel that children with ASD have typical responses to stressful events? We will revisit these questions at the completion of this presentation. It will be very interesting to see if your answers change between now and then. Now let's get started. There are 4 main principles of wellness which must be considered when striving for emotional and physical health and well-being. Those are exercise, sleep, nutrition, and emotional regulation. Individuals diagnosed with autism spectrum disorder often have difficulties in all of these areas. Let's begin with exercise. Although children who have been diagnosed with autism may be very active, they often lack coordination, balance, core strength, and the ability to motor plan successfully. These issues make it extremely difficult for many children to excel in gross and fine motor tasks. Studies have shown that the cerebellum, which is the motor and coordination center of the brain, is not functioning well in many children with ASD. The good news is that studies have also shown that consistent exercise promotes growth of the cerebellum and in turn may mitigate some of the motor difficulties in the children that we serve. Through regular exercise, studies have gone on to demonstrate growth or increased activity in areas of the brain other than the cerebellum, which we know are responsible for learning, memory, maintaining attention to task, planning, decision-making, and self-regulation. Another extremely important and positive outcome of exercise is the release of chemicals in the brain which are known to decrease chronic stress and anxiety. So it is clear that exercise improves motor performance and promotes general wellness by helping to ensure a healthy brain and a healthy body. Since exercise is so vital to brain and body wellness, it is ideal to exercise daily. Incorporating frequent movement breaks within a child's day is a very important strategy and helping that individual maintain an internal state that is optimal for learning. Such breaks could include taking a brisk walk or a jog, or simply doing calisthenics within the classroom. Cardiovascular exercise, balance training, as well as strengthening exercises and flexibility work can all be built into a child's daily schedule and in turn promote consistent physical activity. The next general wellness principle that we will touch on is sleep. It is very common to see sleep irregularities in children with autism due to a number of factors, including behavioral, sensory, biological, and/or medical issues. The most common sleep difficulty that we see in which a biological factor may play a role is irregular sleep-wake cycles. This may be due to circadian rhythm abnormalities, meaning abnormalities within our internal clocks. Behavioral and sensory factors may lead to difficulty settling down, delayed sleep onset, and inefficient sleep due to factors such as anxiety, difficulty with transitions, and arousal dysregulation, meaning that the child is unable to independently calm themselves in order to reach an internal state which would allow for sleep. Fragmented sleep may be due to incontinence care or outside factors like noise and light. Medical diagnoses such as reflux and constipation may disrupt sleep due to pain. Seizures are another medical condition which may disrupt sleep. It is very important to note that a child may be suffering from sleep disturbance due to a varied combination of these behavioral, sensory, biological, and medical factors. To promote healthy sleep, we can incorporate daytime exercise, limit screen time before bed, ensure that the child's bedroom temperature is comfortable for them, and ensure that there is minimal to no light coming into their bedroom. We can promote consistent bedtime routines through calming activities and the use of visual or object schedules. Sensory strategies before bed may also be helpful and may include the use of lotion, massage, calming scents, weighted blankets, and white noise. Let's move on to the third general wellness principle that we will discuss today, that being nutrition. We have already learned that children with ASD generally have trouble with coordinated movement and may not get regular exercise. That, coupled with the fact that kids gravitate toward a limited variety of whole healthy foods, creates a perfect storm for gaining weight. Children with ASD have a 33.9% higher risk of obesity than their neurotypical peers. Their diets tend to be high in heavily processed foods, which tend to be low in very important nutrients. Many diets do not include fresh fruits and vegetables, which contain important vitamins and minerals for general wellness. Some children are highly selective in the foods that they will even consider eating. This is for a variety of reasons, which may include sensory issues, difficulty chewing and swallowing, as well as behavioral challenges around mealtime. All of these factors can lead toward a higher risk of nutritional deficiencies in our kids. To begin to address these issues, we may start by presenting whole foods as much as possible, or at least offering lightly processed foods when the ingredients are recognizable. We should also limit high sugar options like candies, cakes, and cookies, and increase intake of protein such as healthy meats, beans, and nuts, along with fiber such as fresh fruits and vegetables. It is important to remember that food should not be used as a reward or punishment. The final general wellness principle that we will talk about today is emotional regulation. ASD has been associated with atypical emotional responses and deficits in emotional regulation. These factors underlie some of the significant behavioral challenges that we see in the children we serve. What triggers an emotional response in a child with ASD is often very different than what triggers an emotional response in a neurotypical peer. When a child with ASD experiences an emotional response to a situation, it is often much more intense than a neurotypical peer. Furthermore, once triggered, a child with ASD can take much longer to calm down. Research has shown that children with ASD experience more anger and anxiety and less positive emotions than their neurotypical peers. Children with ASD are also likely to experience changes in mood very quickly. Research supports that children with ASD are more likely to use avoidance, repetitive behaviors, aggression, and/or self-injurious behaviors to manage their emotions. Due to these factors, children with ASD are at a significantly higher risk for an anxiety or depressive disorder. These problems with emotional regulation are further complicated when emotional regulation techniques are not employed. So let's discuss some techniques that we can use. Strategies to tackle emotional regulation can vary in complexity. For consistency and safety, always follow the strategies outlined in a child's behavior intervention plan, or consult with a clinician prior to implementing any of these strategies if they seem unclear to you. Environmental strategies that have been identified in research include avoiding, limiting, or slowly increasing exposure to emotional triggers, replacing maladaptive regulation techniques with more adaptive ones, such as functional communication or ways to express needs more appropriately, relaxation strategies such as deep breathing or progressive muscle relaxation, and exercise like walking or yoga can be used to decrease stress proactively or during periods of increasing emotional escalation. More advanced techniques overseen by clinical or teaching professionals may be used to assist with improving emotional regulation and decreasing maladaptive behaviors. Programs include the zones of regulation and the incredible 5-point scale. These techniques focus on increasing the connection between feelings, thoughts, and behaviors with a goal of improving emotional and behavioral regulation. Cognitive reappraisal and cognitive behavior therapy are advanced strategies used mostly in counseling that have also been shown to be effective in connecting thoughts, feelings, and behaviors with the goal of better emotional and behavioral regulation. These techniques have been found to be most appropriate for verbal students capable of engaging in more abstract concepts. With any advanced techniques, please consult with agency professionals to learn more. Now that we have discussed the 4 main areas which contribute to optimal health and well-being, we may begin to talk about the implementation of general wellness principles for the children we care for. Some good starting points are outlined on this slide and include daily bouts of vigorous exercise, as well as frequent movement breaks, the regulation of sleep cycles through consistent bedtime routines, the addition of healthy foods to one's diet, for example, protein and fiber-rich foods, and the incorporation of chronic stress-reducing strategies like exercise, deep breathing, yoga, and progressive muscle relaxation. The importance of promoting general wellness for children with autism spectrum disorder cannot be understated. It is up to us to put general wellness supports in place. We must reinforce these supports and the positive behaviors related to general wellness on an ongoing basis to ensure that the children we serve are afforded every opportunity to boast healthy minds and bodies. Here are the same questions that you were asked at the beginning of this presentation to gauge your level of knowledge on this topic. Let's take a moment and answer the questions again. Let's see if your answers have changed. Children with ASD may present with irregular sleep cycles. We know the answer to be true. As a group, children with ASD present with higher rates of overweight, obesity than their peers. We know that answer is true. Children with ASD have typical responses to stressful events. We now know that that is a false statement. If you are interested in more information related to this training, please see the contact information on this slide. We truly hope that you have enjoyed and learned from this presentation and would like to thank you for your time and attention.